subject. Obviously, Sarah has just been telling us that they've let it be known that the King personally told members of his family, his siblings and his children of this cancer. Told the Prime Minister and then told all of us. I just want to get some medical reaction to that way, perhaps a slightly more modern way of dealing with, back in the day, don't forget, people used to call cancer the big C. They wouldn't even say the word cancer. So I just want to bring in GP Dr. Ellie Cannon, to talk to us a little bit about that. Ellie, we'll talk about the King's diagnosis and cancer and so on. But on this issue of going public, for somebody of his generation, it probably doesn't come completely naturally.
I think that's right. And certainly during sort of my career in the last 15 years being a GP, even during that time, we've seen quite a change. And you're absolutely right. Sort of 20, 40 years ago, people wouldn't have even necessarily told their family, told their friends. They would have talked about having treatment, not necessarily sort of named it as cancer, whereas obviously this is now the antithesis of that, actually saying to the public, this is cancer, although of course they haven't said specifically which one, which I think is sort of purposeful, so we are not sort of speculating about prognoses and treatment and this sort of thing, which I don't think would be helpful for anybody. We know from the past couple of weeks that him talking about sort of treatment for his prostate has hugely increased public awareness and driving people onto the prostate charity websites as well as the NHS. And this will do the same. We know this is what happens when somebody in the public eye has cancer.
And it's interesting, isn't it, Ellie, thinking about, obviously the King is not like the rest of us, in that every little thing about his life is poured over, is a matter. Certainly people are interested. How much of it is of public interest is a different debate. But we know that people around the world will be following his cancer treatment, his cancer recovery, hopefully, and so on. And I wonder, looking at him, we know he is a fit man. He's a man in his 70s. Any sort of chemotherapy or immunotherapy, radiotherapy, will take its toll.
Yes, it will. I mean, I sort of have seen obviously some posts already on social media, and I think it's important for people to realise that in many situations now, cancer is treatable. People can carry on working while they're having treatment, depending what that treatment is. There's obviously, as you mentioned, a whole range of treatments, from surgery through to immunotherapy, through to chemotherapy. Even within chemotherapy, that can look quite different. That can be tablets, or that can be an intravenous infusion in a hospital. So it's a whole sort of potential range of different things. Obviously, he is in his mid-70s, but as far as we're aware, his background health is very good. So certainly hoping for the best in terms of the treatment that he's going to have.
And Ellie, we know that the King has long been interested and a proponent of some sort of alternative therapies. I think he's talked about homeopathy in the past and all sorts of special diets and so on. And I wonder if what your advice, or how you would view that side of things. Presumably there are other complementary things he could be doing alongside his treatment.
Well, to be frank, nobody who wants to treat a cancer is going to be used homeopathy, but there are certainly things that are not medical that many people with cancer and many cancer specialists would recommend that you do alongside. Of course, how we look after ourselves, our diet, if possible, doing exercise, spending time with family, getting a lot of rest is really, really valuable. And I think that we know from people who've gone through cancer treatment that having those sort of positive aspects to one's life, whether that is looking after yourself in terms of what you're eating or making sure that you're spending time with family, can be really, really valuable for that positive mental attitude that's necessary for cancer treatment.
All right, well, thank you very much for joining us on Talk TV to discuss that breaking news, Dr. Ellie.